Hello again and welcome to another video by Soton Anatomy Hub. This one covers the autonomic nerve supply to the lungs. Stay tuned to find out more. Okay, so let's have a look at the general arrangement of our parasympathetic and our sympathetic nervous system. The parasympathetics consists of mainly the vagus nerve. The vagus nerve is cranial nerve number 10, and it's the main nerve that innervates the thorax and the abdomen for parasympathetic nerve supply. The sympathetic nerves come from the outflow of T1 to L2 from the vertebral column, and they flow into the sympathetic chain. That's the paravertebral ganglia. And from there we have nerves called splanchnic nerves that leave there, in this case dealing with the heart and lungs. These are of course called cardiopulmonary splanchnic nerves. So let's just recap our basics here. Let's have a look at the parasympathetics first and foremost. It's going to consist of a pre-ganglionic nerve fibre. The neurotransmitter in question is acetylcholine, and it's working on nicotinic receptors. This leads on to a post-ganglionic nerve fibre, and again ACH, and this time muscarinic receptor for ACH. The main role of the parasympathetics, particularly in the lungs here, is going to be one of bronchoconstriction. Let's think about our sympathetics now. Again, that's going to have a pre-ganglionic nerve fibre. It's going to be using ACH and working and acting on nicotinic receptors. However, the post-ganglionic nerve fibre is going to be acting mainly using noradrenaline, and it's going to be acting on two receptor types in the lung, and we're going to be dealing with alpha 1 and beta 2 receptors. The job there is going to be one of vasoconstriction and bronchodilation. So let's first of all take a look at the distribution of our vagus nerve. We're going to draw our vagus nerve coming in, so I'm drawing it in between the common carotid artery in red and the internal jugular vein in blue, and it would normally travel within the carotid sheath, and on this right side it gives off a branch just underneath the subclavian artery, which doubles back underneath there and travels back up here. This is the recurrent laryngeal nerve travelling and ascending back up in the tracheoesophageal groove, but the rest of the nerve travels deep down here and will contribute to a plexus. We'll come back to that. Let's just draw the recurrent laryngeal nerve on here, there. On the left hand side we can draw it coming down. We lose sight of it here, and the recurrent laryngeal nerve is given off slightly lower. It's given off around the arch of the aorta, so we can draw it coming back around here. So that's our recurrent laryngeal nerve with the arrow pointing upwards. Those two nerves are going to supply the majority of muscles that move the vocal cords. These are not parasympathetic. The parasympathetic nerves that we're interested in are going to be a direct continuation down here of the vagus nerve to form a plexus, and that plexus is going to form around the carina, the bifurcation of the trachea, and the preganglionic neurons will synapse onto postganglionic neurons around the hilum of the lung, and eventually those nerve fibres will travel deep inside the lung and follow down as far as the bronchioles, where they have smooth muscle around them, and act to bronchoconstrict the smooth muscle there to close and make the lumen smaller in the bronchioles. So that's the distribution of our vagus nerve. We can say just very quickly, after that the vagus nerve forms another plexus on the esophagus called the esophageal plexus. Then it travels with the esophagus through the esophageal hiatus at the level of around about T10, and then on to the abdomen and stomach in particular. Let's deal with the sympathetics then. How do sympathetics reach the heart and lungs, predominantly the lungs? They're going to leave this area here. So this area in blue here is where we'd find the sympathetic nerve cell bodies that would only exist between the vertebral levels T1 to L2, if you remember. However, we need to remember that specifically for the lungs and the heart, the major outflow that's occurring here is from T1 to T5. So let's go back to our nerve leaving here. It's going to leave and it's going to travel down the ventral root and out via the ventral ramus. It's going to travel around here and it's going to enter into the sympathetic chain via the white rami communicantes, RWC for short, and what it's going to do is it's actually going to ascend all the way up to cervical levels. Let's have a continuation of that diagram. So let's imagine now, here we are, just concentrating on our outflow from T1, T2, T3, T4 and T5, and we can draw outflow coming like this into the sympathetic chain from each of those levels, and of course there would be ganglia there, and they would ascend all the way up to cervical levels, which would be in the neck, and from there we would have a collection of nerve fibres. So we'd have those sympathetic nerve fibres with synapse, and these would be the preganglionic fibres travelling up like that. These would be the postganglionic fibres, because the synapse would have taken place in here where these arrows are, and these fibres coming down here would be innervating the heart and lungs, and these are known as cardiopulmonary splanchnic nerves. Okay, thanks for listening. See you again soon.